Good morning, everybody. My name is R. Joram Methusala. I am working as Associate Professor in Department of Pharmacology, Dr. K. Subbareddy Institute of Pharmacy. So today I would like to discuss with you about antibiotics. First, we'll see what are antibiotics. Antibiotics are the chemical substances that are obtained from microorganisms like bacteria and fungi and are used to kill or stop the growth of other pathogenic microorganisms without affecting the host tissues are called as antibiotics. Antibacterial agents are those drugs that interfere with the growth and kill the bacteria. Next, coming to antifungal agents. Antifungal agents are those that selectively eliminate fungal pathogens without causing much toxicity in the host cells. We have different types of antibiotics like penicillins, cephalosporins, monobactams, carbapenems, aminoglycosides, tetracyclines, and so on. Today we will discuss about folic acid synthesis inhibitors. So folic acid enzymes are necessary for the bacteria for synthesis of amino acids. Therefore, they are important for protein synthesis of microorganisms. So we shall be discussing about certain drugs like sulfonamides and trimethoprim, which will act as folic acid synthase inhibitors, or that will interfere with the synthesis of folic acid. So sulfonamides. Sulfonamides were the first effective chemotherapeutic agents to be employed for prevention and cure of bacterial infections in man. Sulfonamides or sulfa drugs are the basis of several group of drugs. These antibacterial sulfonamides are synthetic antimicrobial agents. Some sulfonamides are also not having antimicrobial activity like anticonvulsant sulfonamide. The development of sulfonamides was a profound therapeutic revolution in the history of medicines. Sulfonamides were first synthesized by a German chemist named as Bayer in 1908. Then coming to the chemistry, the sulfonamides contain SO2 NH2 group, which is sulfonamide group. They are also called as para-aminobenzoic sulfonamides. These are white crystalline powders which are acidic in nature. SO2 group is not important by itself, but sulfur is directly linked to the benzene ring, and the para-NH2 group is essential for antimicrobial activity of sulfonamides. Sulfonamide is derived from a prodrug called as frontosine. Sulfonamide is a structural analog, that is, it is having a structural similarity with PABA. PABA is nothing but para-aminobenzoic acid. It inhibits bacterial folic acid synthesis by acting as completer with power, that is para-aminobenzoic acid, because of the structural similarity of sulfonamides and para-aminobenzoic acid. It is bacteriostatic in nature. Bacteriostatic means it will inhibit the growth of bacteria, whereas bactericidal means killing the bacteria is called as bactericidal action. Sulfonamides are having bacteriostatic action. They do not have broad spectrum of activity. Spectrum of activity means the various or variety of organisms against which these sulfonamides are effective. Structure of sulfonamides includes NH2COOH in case of carbon and sulfonamides contain NH2 group with SO2 NH2 group attached. That is the structural similarity between papa and sulfonamides. In place of carboxyl group, there is sulfonamide group called SO2 NH2. Coming to the pharmacokinetics, sulfonamide's route of administration is oral. That is, they are well absorbed from the upper gastrointestinal tract and they are distributed in serious placenta. And 20 to 90% of drugs are plasma protein bound, and especially they are bound with albumin, which is a plasma protein. Sulfonamides undergo metabolism by liver by the process of acetylation, which include both rapid acetylators and slow acetylators. The people who acetylate the sulfonamides faster are called as rapid acetylators and slower are called as slow acetylators. Excretion of sulfonamides is through urine, by kidneys, and by glomerular filtration and tubular filtration. Classification of sulfonamides. First class of sulfonamides are agents absorbed rapidly and excreted rapidly. They include short-acting, intermediate acting, and the examples are sulfoxazole for short-acting, sulfametazole, and sulfacycline. Whereas coming to intermediate acting, we have sulfamethoxazole and sulfasobenzole. Coming to the second class of sulfonamides, we have agents absorbed rapidly but are excreted slowly, which include long-acting sulfonamides and ultra-long-acting sulfonamides. The examples of long-acting sulfonamides are sulfa-dimethoxin and sulfaphenoxone. Ultra-long-acting sulfonamides are sulfadoxin and sulfasalazine. Sulfasalazine is also used for treatment of inflammatory bowel disease. Then third class of drugs are agents that are absorbed very poorly when given orally. Examples are sulfaguanidine and succinyl sulfathiazole. Fourth class of drugs are sulfonamides used topically. The examples are sulfacetamide and sulfafurazole. Coming to the fifth class of miscellaneous sulfonamides, we have sulfapyridine and sulfajimidine. Coming to the mechanism of action of sulfonamides, folic acid is essential for the growth of bacteria. It is a precursor of purine, which is a precursor of DNA and RNA. Para-aminobenzoic acid, which is PAPA, is a precursor of folic acid. And sulfonamides have structural similarity to PAPA. Bacteria synthesize their own folic acid from PAPA. In the bacteria, sulfonamides compete with PAPA for the enzyme folic acid synthetase and prevent the incorporation of PAPA into folic acid. So, folic acid is not synthesized. As a result, bacteria are deficient or deprived of folic acid and they cannot grow or multiply. Sulforamide overview. Dihydrofolate diphosphate plus FABA in presence of dihydrofolate synthase gets converted into dihydroxylic acid, which is further converted into dihydrofolic acid or dihydrofolate, which in presence of dihydrofolate reductase gets converted into tetrahydrofolic acid or tetrahydrofolate, which is converted into nucleotides like purines and pyrimidines, which are further converted into DNA, which helps in growth of bacteria. Sulfonamides are indicated not singly, but they are usually given in combination with other drugs. They are used for treatment of typhoid and paratyphoid fever, acute and chronic UTIs, that is urinary tract infections, topical application for infected burns, meningococcal meningitis, bacillary dysentery, gonorrhea, dermatitis, and for intestinal sterilization or gut sterilization. Adverse effect of this is sulfonamides on urinary system. They precipitate acidic urine and form crystals which pass in the urine. They cause renal irritation, crystalluria, spasmodic pain, hematuria, tubular necrosis, oliguria, and aliuria. On hemopoietic system, sulfonamides have effects on bone marrow depression, aplastic anemia, thrombocytopenia, eosinophilia, and agranulocytosis. On GIT, they cause anorexia, nausea, vomiting, and diarrhea. The major adverse effects of sulfonamides is allergy or hypersensitivity reactions, which include skin rashes, exfoliative dermatitis, anaphylaxis, Stevens-Johnson's syndrome, which is a lesions that are formed on skin and the mucous membrane, which further may become fatal to an individual. Contraindications of sulfonamides are pregnancy and in infants and neonates, because the sulfonamides have the ability to cross the blood-brain barrier and cross the placenta and able to cause damage to the fetus and to the neonates. Therefore, they are contraindicated in pregnancy and in neonates and infants. And they should also be not given in individuals who are having renal impairment and dehydration. And the dosage form is for adults 2 to 4 grams initially as the first dose, followed by 1 gram every 4 to 6 hours. And for children below or 2 months of age, dose is 34 mg per pound, and up to 2 months of age it is not recommended. And commercial name of sulfonamides is sulfatrin, pharmaceutical name is Opsonil, Cedra, Orion, and Bactrim Square. Thank you very much.